Okay.
Hi, this is Jennifer Lessie here. We are going to be filming an intravenous cephalic catheter today with our patient Max. We have our assistant here who's going to help me out with restraint. We do have doctor's orders for Max today. We are going to be placing an IV cephalic catheter. There are no fluids needed for Max, so we are just going to be using an injection port for him today. We have our tray of supplies. So I have my clippers here. We have our sharps container. We have our chlorhexidine scrub, which we're going to use in alternating patterns with our isopropyl alcohol. And then there is our isopropyl alcohol that we'll be using. So again, we'll start with the chlorhexidine scrub, and then we'll go to the alcohol, and we'll repeat that 3 times, and we'll go in a bullseye like pattern. We also have gloves. We've pre-cut our tape, and I've got more tape here. We have our vet wrap. I'm going to go ahead and stretch that out already to make sure that we don't constrict the patient's arm when we wrap that catheter. We have both 20 and 22 gauge catheters just to see what we want to be placing given his vessel size. So once we palpate and get a look at that, then we'll go ahead and make that decision. And we have our injection cap, which is what we're going to be placing. We have our isotonic saline solution that I'm going to be prepping the catheter with, as well as flushing to check the patency of the catheter once it's placed. We want to make sure that there is no extravenous fluid, and we are going to be administering at least 2 mils of the isotonic sterile saline solution to ensure that we do have a clear catheter placement. And we have our sterile paper towels as well. So those are our supplies. I'm going to go ahead and have our assistant, she's going to get the muzzle on for Max. Just that way he is safe from harming himself or from us. And then we are going to keep Max in a laying sternal recumbency. So if you can go ahead and restrain his head and pop up his leg. I'm going to go ahead and start with shaving. I'm going to shave a nice rectangle pattern. I am going to go throughout the circumference of his arm to make sure that when we remove the catheter that the tape does not bother that fur. Let's stop biting. Okay, if you can go ahead and occlude, we're just going to see that vessel size so I can assess which catheter, and I can feel that nice palpation right here, and you can see that bounce. So we're going to go ahead and place that 22 to make sure we have a nice clear lead in there. All right, so you can go ahead and let him relax. I am going to set up our catheter before we scrub. Once I prep the catheter, I'm going to go ahead and place it on the cart. Nobody is coming into the building on that side, so we do not need to worry about anybody bumping the catheter. So if it does go off film, we know that it's still maintaining its sterility and staying in its packaging. So again, I'm going to go ahead and use a 22 gauge catheter. Can you see this okay?
Yes.
I'm going to go ahead and flush. You can see that the fluid is collecting in the reservoir of the cap, so I'm just going to place that right on over here. It's nice and easily accessible. And then I'm also going to loosen the injection cap. There you go. And that is going to stay right on over here as well. Okay, so catheter is prepped. If you can go ahead and extend the limb and occlude the vessel for us, we are going to then scrub.
Okay, I'm just going to come over on this side.
Yep. All right, buddy.
Beautiful.
Good boy. All right, so I'm going to start with that chlorhexidine. And then the alcohol. That's one. Two. I'm gonna go ahead and start that one over since he flinched and I lifted up. And that is 3. So if you've got a good hold there, just go ahead and keep him stable. I'm going to grab our drape so I can place our catheter. I'm going to clean it out. So I'm going to place our towel. All right, so now I'm going to go ahead and place that catheter. We are going to place the catheter bevel side up. So I'm going to go bevel side up. You have a nice hold on him. Perfect. We have a nice flash. I'm going to go ahead and advance. And then you can release. Place that in our sharps container. Grab our cap. Okay. So that is placed. So now we no longer have an open vessel. So I can remove my gloves. There we go. And I am going to just wipe. Good job. Making sure that I am not touching that insertion site. to go ahead and check the patency. And then I'm going to feel for a nice swoosh. And then I can also kind of see that backflow. So we are successfully in the vessel, and if you look, if you can see that there is no extra venous fluid there. So we have successfully placed the catheter. So I'm going to place this in the sharps container, and then we are going to wrap. And I'll just add a little bit more to make sure that that is fully covered. Alrighty, and that is how you successfully place a cephalic catheter in a canine patient. Alright, so I'm going to discuss some of the precautions when placing a IV catheter. So we are definitely going to check for infection at the insertion site. So we may see an increased body temperature in our patient, redness at the site, swelling as well, and we may see phlebitis. Phlebitis is going to be hardening of that blood vessel. We are also going to monitor and watch our animal if they become restless in the enclosure. So if they're circling, if they're trying to gnaw at or rub and lick that catheter, that may also show us that there's some signs of something being wrong with it. We may have some swelling at the distal portion of that catheter wrap. So if the paw is swelling at the distal edge, then you want to make sure that you unwrap. Generally, distal swelling is going to be because of the bandaging and the wrapping is too tight. So you're cutting off that circulation. So then you just rebandage. If the catheter is still properly placed, then just retape if needed, and then just rewrap your bandage. If you are noticing swelling at the proximal end or closer to that elbow, closer to the body, then that is more than likely a sign that the catheter has actually been dislodged and is no longer seated properly in the vessel. So for that, you're going to want to unwrap, and then you will probably have to replace that new catheter. You can see, depending on the quality of that vessel, that leg, if you notice it right away, you may be able to insert a new catheter using that same vessel, but it would definitely be a good idea to switch and see if you can then use the opposite limb for that catheter placement if you did get that swelling proximally and blew that vessel. Some ways to kind of avoid that is going to be making sure that you reduce your clipper burn. So if the clipper burn is reduced, this is going to avoid just the animal wanting to irritate that insertion site in general, because that area is not going to be bothered or irritated. Another sign that we're going to be looking for is lethargy. So we may have that restlessness, but then you also may have your animal become restless. So it is important that we're checking vitals. Every 1 to 2 hours, we want to be checking our vitals according to our low textbook. We want to be also checking the patency of our catheter, or the ability that it's still knowing that it's still in the line. Every 4 to 6 hours is what the textbook says, but it definitely doesn't hurt to check it more often than that. Again, just to make sure that we do have a good flow. If you're not running fluid lines, so we do want to still manually check that to ensure that it is properly placed. If you do have a flow going, if you do have fluids flowing into that catheter, you are going to definitely want to monitor that the line is not kinked in any places. You're going to want to
clean those injection ports with alcohol if you are going to be utilizing those injection ports to inject your medications. You're also going to want to make sure that the T-port hasn't kinked, and that you're actually opening and closing the line when needed. So using your clips to clip off that line, so that way that medication or the fluids is going exactly where you need it to go. And then also that blood doesn't backflow up the line if it's not attached to those fluids, right? Another thing to prevent damage to the catheter site or that catheter being pulled out, you want to ensure that you have a secure tape job, so not too much tape and not too little tape, and then you can do the crisscross with the thin piece of tape across that catheter to secure that in once you've placed the vet wrap on. And you can also use the vet wrap to secure overlaid on that catheter hub. If you use the T-port or if you just use a cap, you want to make sure then that vet wrap can be securing that in the line as well. And definitely checking for that patency is going to help ensure that it is working and that it's still in and not dislodged. We often will use, at our clinic, we have our animal in an e-collar, so we always place an e-collar with our patients. We'll use a soft e-collar for our cats or other animals that may be more discomforted by an e-collar placement, but that's a great way to ensure that they're not getting at the line. So the tape, the e-collar, there is bitter apple spray, of course, you could use. Also making sure that that site is, again, clipped well, but that you've avoided clipper burn, because that, if that is going to irritate the site of insertion. So you want to make sure, again, that you are monitoring that so the arm is not like scratching and getting painful from that razor burn. And then if we are going to use heparin for our flush, we are going to use 5 units to 1 milliliter of sterile saline. So what we would do is we have our 1 liter bag, and we would then insert 5 milliliters of heparin into that 1 liter bag of saline flush, or of that bag of saline, and then with the 5 milliliters in that 1,000 milliliter bag, that would then give us 5 units of heparin per 1 milliliter of saline for when we utilize those flushes. And again, we're using that flush to ensure that we are still good in our catheter, that our patency is being assessed and is of good quality, and keeping everything clean and clear. We also, again, are going to be checking our vitals on our animal every 1 to 2 hours to make sure that we're monitoring for signs of infection or poor placement of that catheter. When we are monitoring the pause, we are going to look for temperature increase or decrease, and again, that swelling at the distal or the proximal end of that catheter.